Hi, I'm Professor Filippo Graziani from the University of Pisa, and I teach periodontology, and I've been doing periodontology all my professional life. Well, what the Emdogain FL is really is the application of the Emdogain material, which is the regenerative material that we've been using in periodontal surgical treatment for the last 20 years, in a closed environment, in a non-surgical environment. Well, basically, we collected a group of patients affected by severe periodontitis, and we randomized it in two groups. Both groups would receive a non-surgical treatment, a full mouth ultrasonic debridement, but then one group, the test group, would also have received Straumann flapless Emdogain at the end of the treatment in deep pockets. So that means that one group was also receiving additional Emdogain FL at the end of the treatment. I think the two most important ones are one local and one systemic. From a local standpoint, we increase the chances of not having to go through surgery when applying Emdogain FL, because basically the 40% of the group did not present any deep pockets after treatment versus only the 10% in the control group. So there was less need for surgery. But also from a systemic standpoint, there was no increase of the dimer 24 hours after the treatment. And the dimer is related to the degradation of fibrinolysis, of fibrin. So we speculated that this was the effect of a higher blood clot stability, which actually would explain the reason why it works so well from a local standpoint. Well, of course, you have one benefit that is related with the surgical need. Nobody would like to have surgery, and of course, if you enhance the chance that non-surgical is definitive, or at least it's higher potentialities, that I would have a tremendous benefit from a psychological standpoint, economical standpoint, but also you have to take on board the fact that basically every time that you treat perio, you also reduce the systemic inflammation of the person, you improve the systemic well-being, and also you improve the quality of life. So the better is the treatment, the higher is the overall impact on the persona. Yes, I think it is important. What is the crucial phase is to try to get the material in contact with the root surface. But the pocket is bleeding. So I would suggest, first of all, when a pref gel is applied, to press it once to remove the blood clot, suction it, and then press it very strongly so that the pref gel would dislocate the blood. Then we also, after the rinse in 2 minutes, we also applied some floss in the pocket for 1 minute to dry it, remove it, and then apply an Emdogain, always very strongly, to press it a little bit vigorously. So just to make sure that the higher chance of the material would actually wet the root surface. Well, let's say that to me Straumann has been brave because it's been true as a regenerative company, because they regenerated themselves. An implant company that would try to put money to try to save teeth is actually something very brave, and as a periodontist I can just endorse it.